Hello, thank you for joining us today. My name is Fiona Campbell. My role here at the college is to organise the practice assessment. Some of you will have been involved in an assessment and some of you have yet to be involved in an assessment. But I hope it's going to be a positive learning experience.
I'm Shelley Martin, and I'm the practice advisor here at the College of Physiotherapists, and I answer your questions that you submit to me either by email or telephone.
So today we're talking about that partnership between physiotherapists and physiotherapy assistants. Rehab assistants, support personnel, we're going to use those words interchangeably. But what we do know is every year more and more physios are telling us they're working with support personnel. At the same time, we're receiving more and more questions from you, from patients, from employers, from insurers. So we're going to try and answer some of those common questions and then also take questions from you. We'll try and address those.
So Fiona and I are very happy to have this chance to talk to you today and, as Fiona said, answer your questions and concerns about support personnel. Just so you know, we have more than 450 people registered to participate in this webinar, and they represent all kinds of practice settings, hospitals, children's treatment centers, rehab facilities, private practice, long-term care, and as well we have OTA and PTA students joining us. So thank you. Now, during this webinar, you will have an opportunity to participate in the polling, and there are two ways to do that. To take part in the poll, you can text once using physiotherapy to 37607, or you can join at pollev.com/physiotherapy. Now, during this entire webinar, please submit your questions that you have to communications@collegept.org. Now, hopefully you won't have any technical problems, but if you do, you can email info@livemedia.biz, and that should be on your screen as well. So Fiona is going to test out your polling expertise with a very easy first question.
I think people online are going to be very good at this, as some of you have already started to answer the questions, so you're going to have to do it again. So I'm interested who's there in the room with you listening to this presentation. Is it number one, physiotherapists? Number two, is it physiotherapists and assistants together? Is it number three, let me just go over that again. So one physiotherapist, two physiotherapists and their assistants, and number four, I know you're alone. So it should be there in front of you. Go ahead and answer the options.
Oh, it looks like a fair number on their own, but the numbers are still coming in.
Yeah, the numbers are still coming in. It looks like we've got a good range of just physiotherapists, physiotherapy assistants, and some alone. Okay. Okay, that's great. So I want to say a few more seconds, but that does look like we've got a really good range listening to the presentation with us. And I think it's really important that physiotherapists working with support personnel are hearing the same message about.
Great. And again, thanks for sending all of your questions in ahead of time. We see some common themes, questions around supervision, assignment of care, communication, employer expectations, and consent. Now, just so you know, we are going to do our very best to address as many of these questions as possible. However, if you hear something that you didn't quite understand, you can always call or email me after the webinar. As well, you can also send your questions directly to me after the webinar at practiceadvice@collegept.org. So I'm going to direct the first question to Fiona. And the first question is, can I assign care to volunteers?
Well, the answer is yes, you could. The volunteers are acting as your assistant and you're assigning the care to them. Now, the assistant role is at the moment a job description. And so anyone can be an assistant, but there are some rules that apply and that the physiotherapist must be responsible to make sure those rules are applied. That's ensure who you're assigning your care is competent, they're knowledgeable, they're skilled to deliver the care that you have designed. There must be ongoing reassessments, there must be ongoing communication with that person.
So essentially, the same rules apply to volunteers as they would paid employees.
Absolutely.
Great.
Let's go to the next one.
Okay, so we are going to ask out there, what is the biggest issue facing PTs and assistants in practice? So your options for this polling question are assessing competence, assigning care, supervising your PTA, or communication. And we're going to give you a few seconds to answer this question. What do you think the highest one will be, Fiona?
I think supervising, I know that we get a lot of questions about that when we're taking questions. What do you think?
I think supervision's a big one. Maybe we can switch to the poll results and have a look at what's happening. Oh, interesting. So far, yeah, supervision is coming up strong. We'll give you, 5-10 more seconds?
5 more seconds. Okay.
Great. So so it looked like supervision was the highest response, although each area did have a showing as well, communication, assigning care. But it's not so surprising when you consider some of the practice settings that we have here today, where physiotherapists commonly work with assistants. So the hospital setting, the home care setting, the long-term care settings. So, it's not a shocking response, but it's interesting to see the breakdown. Now, Fiona, I think, has a question as well.
Yeah, we've received a question that was submitted earlier, and I wonder if you could take some time to answer it. Though, can a physiotherapy assistant work on a day when the physiotherapist is not present? Like, for example, the PTA is working a 5-day week, the physiotherapist is at that facility twice a week. Can the assistant continue that care?
Well, I think I'd have to answer this question with it depends. So the physiotherapist has to consider a number of factors when they're thinking about how to assign and how to supervise treatment. So for example, the physio needs to look at what's the skill of the assistant, skill level of the assistant or experience of the assistant I'm working with. Are there other supports in place at the facility where the care is being delivered? How is there a communication plan in place? So there are multiple considerations. In some cases, what you decide for supervision for some patients and assistants may not be appropriate for other patients and assistants. So it's a real, I think, case-by-case basis.
So you're saying that there's the 5 factors to consider. You're really looking at the risk, and the physiotherapist has the responsibility to decide whether the care can be delivered independently. I always wonder, what if something goes wrong? Can you comment?
Well, in any situation, there should always be a plan for an adverse event, whether you're working with assistants or not. So in the case where you know you're not going to be on site, it's really important to have it laid out, worst case scenario, what do we do if? And if you have that laid out for your assistant, as well as perhaps a contact person at the site they're working at, or a way to connect with the physiotherapist, but if you have that laid out in advance, then you'll have a way to deal with it if it arises. So planning and communication are really important.
Great, and we can move on. As a reminder, you can submit an email question at any time. We will try to respond to that. Now, this is the next question. I'm really interested to hear what your answers are. How much input do you have into monitoring the clinical performance of the assistants you're working with? If you look at the options are you the sole source of input, a lot of input, a little input, or no input at all? This is really about how much input is a physiotherapist having into the clinical performance of the assistant. So go ahead and vote. Tell us sole source, a lot of input, a little, no input at all. Do you get asked quite a few of these questions, Shelley?
Yes, I do, and I believe we've received some pre-submitted questions that are similar to this as well, so hopefully we'll be able to get to that.
Okay, shall we have a look at the poll?
Oh, good.
Very interesting. So some of you sole source of input, and that's reassuring, and a lot of you have some input. Most of you have some input. So I would say it's reassuring to know you're having input. It is the physiotherapist's responsibility to ensure ongoing competency of the assistant. They have a role, an essential competency role, to ensure that the physiotherapist is doing the work that's assigned. So it does concern me a little that some are saying they have little input and some, unfortunately, are having no input at all. I think we should talk about that. I'd like to say it is the physiotherapist's responsibility to ensure ongoing competency. It is the physio's responsibility to provide feedback to their assistant. So perhaps those that have no input at all, you can have a discussion with your employer, your organiser, and explain this is a responsibility of the physiotherapist, or perhaps afterwards have a call to Shelley.
Absolutely.
We can move on. Unless there's anything else you could add to that, Shelley?
No, I think with the no input at all, it's important to think of, perhaps if you haven't had input at this point, is think of strategies. You know, where are there opportunities that you can provide input and support and learning and all of those things to the assistant as well as the employer. So I think there's opportunities for change. You may just have to get creative and think about it a little bit. So I think we're going to answer some pre-submitted questions.
I think the next one, Shelley, can you answer this one? The employer requires that I assign most of my care to assistants. What should I do?
So this is a common thing that people report to me when they call in. So it does happen, and you just need to know that everything is based on the same set of rules. So our standards of practice are really about any practice setting. So you want to ensure that your patients consent to the treatment, including the role of the assistant in the delivery of the care plan, and that they understand that if the model of care is such that the assistant will be delivering most of the care, patients should know that as well, for sure. The PT still has to act in the best interest of the patient. They have to first assess the patient, develop the treatment plan, have a way to monitor that treatment plan, and then reassess the patient as appropriate. So communication definitely becomes really important if you know that this is the model of practice.
So let's take another question. Shari, has there been any questions submitted?
Actually, yes. There is a question from one of the PTAs out there who has a concern about their workload and is wondering whether you have any strategies for the physiotherapy assistants to have a conversation with the PTAs about their workload.
Do you want me to try and answer that? I'll start
Sure.
if you want to jump in. So you've got an assistant who's working, they're getting really concerned about the amount of work that's being assigned to them. I'd say the first step would be to have a conversation with the physiotherapist. A good, effective team physiotherapist assistant requires a good, strong communication plan. The physiotherapist needs to hear about that. Now it's the physiotherapist's role to discuss the workload with you and then to come up and devise a plan of how it's going to be managed.
Mm-hmm. Definitely. So it's important, you know, if the PTA doesn't communicate with the physiotherapist that there's workload issues or concerns, the PT won't necessarily know that there's a problem. So the communication is really an important piece. And the college really there aren't caseload standards.
No.
So I can't refer to a certain number of patients or a certain number of hours or expectations in that regards, but it's really important that the PT and the PTA communicate about it.
And it might be the physiotherapist has identified a training need and can work with the assistant, or there could be an opportunity to reprioritize the work.
Yes, absolutely.
If it's not once you've tried a direct communication assistant to physiotherapist, if this isn't working, then might be the time to escalate that to the employer. It sounds like you may have an employer issue, and take it further, but I would try and resolve it directly first.
Yes, I agree. Are there any other questions right now, or can we move to the next poll? Oh, it looks like we're...
I do have another question. So there is one more that I'll get you to tackle now, if that's okay.
Okay.
And the question relates to the home care setting and using homemakers, so not assistants, but using homemakers to assist with a home exercise program. So, Shelley, I'm going to direct this one to you. The person is wondering about how to manage the training and supervision of homemakers in the home care setting, and what kind of oversight or responsibility belongs to the physiotherapist in this circumstance.
Okay, so there's lots of things to go after with this question, and this is a very common question that I do receive. I think where I could start is talking about the role of the physio assigning care to an assistant versus the physiotherapist acting as almost like a consultant and developing a program that's separate from the treatment plan. So, so physiotherapists can assess a patient, develop a treatment plan, and that treatment plan can include independent home exercise program, and that program potentially could be carried out by the patient, the patient's family members, or possibly friends, or a caregiver such as a PSW or a home care worker. So communicating with the patient as well as the team about what that activity is, what the exercise program is really important that they understand. It's a home exercise program. It doesn't mean that the physio is responsible for what happens once those recommendations have been made. I think it would be pretty unreasonable to think that the physiotherapist who has seen that patient perhaps once or twice is going to have knowledge or ongoing responsibility for people coming and going out of the patient's home, doing things with that patient that are being directed by the patient or the patient's substitute decision makers. Do you have anything to add to that, Fiona?
No, I think that covers it.
Great.
Should we move on to the next question?
Great. So the next question, this one's for PTs. We really want to know, how many assistants do you supervise? So you have several options: 2 or fewer, 3 to 6, 6 to 10, 10 to 15, and more than 15. So we'll give you some time. So while we wait, this was actually a question that we had on this is PT Now survey several months ago, and I'll tell you a little bit about Kathleen Norman's results. She was the college's research scientist on this, and so there was a certain response we received, but I'm going to wait and see what our poll comes up with. So maybe we'll have a look at the poll slides.
That's the first time we really got an idea of how many assistants were being supervised at once.
Okay. So far it looks like most people work with 2 or fewer, and followed by 3 to 6. Interesting. And at the moment, the slide indicated that nobody has yet admitted to working with more than 15, but I'd be interested in knowing how any PT would manage that. I'm sure it would be really challenging, but let's have a look at the poll results again. Okay, so maybe, 3 to 6 is catching up a little bit. Okay, so, well, it looks like most people here are 2 or fewer, but I can tell you, in the This is PT Now survey, Kathleen Norman found 35% of the respondents reported working with 2 to 3 PTAs, and so this isn't too far off. Our survey, looks like 2 or fewer, so interesting. I think it's not surprising when you consider so many people work in practice settings where it's normal and expected to be working with assistants. So
And just remember the same rules apply. So there was one, maybe two of you were reporting that you work with 10, 15. That's a big responsibility to ensure that they're competent to deliver the care that you've assigned to them. But we don't have limits, and the college has never set rules on the limits, but we do set the rules on knowing that your person you're assigning the care to is competent to do so.
Absolutely.
Okay, move on to the next one.
Okay. So our next question.
I'm interested in this. Again, no right or wrong answer here, but I'd like to know what's the primary way that you communicate with the assistant? And the assistants in the audience can answer this as well. How do you communicate? And that's the first, the options are 1, do you use written notes or the patient's charts to communicate? Is it face-to-face? Do you meet with your assistant, go through set criteria, organise how the information is going to be exchanged? Do you make telephone calls with each other? Do you use electronic means? Do you email? Do you text? So go ahead, take a moment and answer that poll.
Well, it looks like a lot of people use face-to-face. That's not surprising.
I thought there might be a little bit more of individuals answering by telephone.
Yeah, so did I.
Yeah, I hear a lot of that. It's really important, whatever method you're choosing to communicate with the assistant, and it could be formal, it could be informal. Formal meaning face-to-face, you're going over set information that you're going to exchange, or it could be informal, a telephone call when issues arise. Make sure that both parties, the physiotherapist and the assistant, understand how that communication is going to occur and understand when it's going to occur and what information they need to exchange. Remember, physiotherapists, assistants, you're working as a team. Good teamwork requires an effective communication plan, and I think most of the problems arise when that communication plan is not in place.
Yeah, I agree for sure.
Okay, we can move on.
Okay, so the next slide, the next poll question is near and dear to my heart. I've been fully immersed in working at trying to develop a tool to help physiotherapists assess or determine the competency of their assistants. And so we hope that this tool will be available within the next year. And, oh, you've already started your poll question, so I'll jump into the poll question. So how do you assess the competence of your assistants you work with? So you have some different options. You could rely on a manager or employer to determine competence. I talk to them and get to know them. I use an orientation checklist or a formal assessment tool, and my workplace has a performance review system. So, wow, it looks like it's very one-on-one based, talking and getting to know the assistant. Interesting. Now, there is, as I mentioned, we're working on a tool to help physiotherapists with this performance expectation in the standard, and because right now we require that you ensure that the assistant can carry out the assigned care safely and effectively. You want to ensure the best interests of your patient, but we don't define how you go about doing that. So there's a lot of flexibility. There are no right or wrong answers here. It's more about getting a temperature read of what people are currently using. And I have to say, I'm really interested. I'm looking at response C. I use an orientation checklist or formal assessment tool. And for those facilities that have something like that, I would be thrilled if you could share this resource with me. If you can email it to me at practiceadvice@collegept.org, I would love to see what you're using, and that would help inform the work that I've been doing on developing the competency tool. So thank you. Interesting. All right. So let's see now. So the competency tool, now the one thing I should mention in those results was the face-to-face get to know the PT. Now getting to know the people you work with is really, really important. But you want to be thoughtful about the fact that talking and getting to know them may not ensure that the person has the hands-on skill to do a certain task. So in some cases, depending on the orientation or the training of the individual, there might be a requirement to watch the person provide training, watch them to perform the technique you've assigned, watch them do it with the assistant. So sometimes, although a lot of you use the talking and sharing information and getting to know each other, that may not work in all circumstances.
Okay.
So let's
Should
move on.
we move on to some questions?
Great. So we've received more questions, and thank you again for pre-submitting
Yep.
your questions. Now, the next question, I'm going to let Fiona answer
Okay.
this one. Can I assign an outcome measure such as Berg balance or a 2-minute walk test to my PTA? Is this considered an assessment?
We get a few questions about this, and I would say in most cases, yes, you can. If the assistant is appropriately trained, they know how to gather that information for the physiotherapist, they can do that on assessment, on reassessment. It's what you do with the information that matters. It's the physiotherapist's role to take that information, interpret it, and put it into a decision plan.
Exactly. That's a great answer.
What about the next question? If you have a physiotherapist working with a physiotherapy assistant, and that assistant is a trained Pilates instructor, and they're good, they've got a good reputation in the community, can I, the physiotherapist, assign care to that assistant for Pilates?
I think this is going to be one of those great responses where I'm not going to say yes and I'm not going to say no, I'm going to say it depends. So there are a number of factors that weigh into this. So first of all, obviously the treatment needs to help the patient achieve their treatment goals, and the physio is going to assess and reassess the patient. So that's one piece of the puzzle. Secondly, the physiotherapist needs to be able to deliver the treatment that they have put in a treatment plan. And so, for example, I'm going to use something outside of this example. Let's say kinesiotaping. I have never personally taken a kinesiotaping course. So if I was developing a treatment plan for my patient, I would never put that in the treatment plan because I don't have that skill. Could certainly refer to someone else, but I wouldn't do it myself. Now, in the case of Pilates, for example, would you, if your assistant called in sick, and that person was going to participate in a Pilates class or a one-on-one session, would you be able to deliver that session? So are you competent to deliver that care? And on top of that, the competency piece of the physio is so important because the physio has to ensure that their assistant is competent in delivering that care. So the physio needs to have that skill to do so. Again, it depends. It may work in some circumstances, but it may not work in other circumstances.
So bottom line, it depends. If
It
the
depends.
physiotherapist has the skill themselves and the assistant has the skill, it can be assigned. If the physiotherapist has no training in skill or competency in a particular activity, then they can't assign it to someone else.
Okay.
Seems pretty straightforward.
Yeah. Now I have one for you, Fiona. Can I assign physiotherapy care to a chiropractor or a registered massage therapist? What do you think?
Reminds me of the question earlier about can I assign it to the volunteer? And I think I'm going to answer this exactly in the same way. It depends. Anyone can be an assistant if they've got the appropriate training and competency to deliver the care that the physio is assigning to them. The physiotherapist still has to ensure they're competent. They can't, just because they're another regulated health profession, a massage therapist or chiro, I don't think you can assume they're competent in a particular area. You have to evaluate, you have to provide feedback, you have to provide ongoing reassessment. I would wonder why though. Why would you?
And you know, assigning care to an individual means that you, the PT, have ongoing oversight of the PTA and the patient's treatment. You can't just give that responsibility away. And I would also question some of the motivation behind that decision to assign the physiotherapy treatment to another regulated health professional. So is the model of practice simply enabling the patient to access health care that they need, the physiotherapy, or is it to access health benefits that the patient may or may not have? So you have to look at what is the motivation behind the model of practice. And if it's simply a a money topic or a money issue, it could lead to problems. And you really want to consider how others may perceive this action. So if you think about an insurer, to an outsider like an insurer, they could view this as manipulating the billing processes.
Yes.
to treat the plan versus treating the patient.
Okay, I see there's another question. Maybe I'll answer this one. It's common. People ask, can physiotherapy assistants remove acupuncture needles? We'll address that. It used to be a common question, not so much now. A few years ago, the law changed. The Regulated Health Professions Act changed, which means that without getting into the details of the law, it means an assistant cannot provide any aspects of acupuncture.
That's right.
The physiotherapist has to retain that. So to be clear, quite simply, no, the physiotherapist assessment cannot insert, cannot remove needles. That remains with the physiotherapist.
Okay. And so we also, now we had a couple different questions come in from PT assistants.
Yeah.
And there was some concerns about bullying and bad behavior by their supervising PT, which is unfortunate. And so really it's asking about what do you do if the physiotherapist's behavior is off. So it's a really unfortunate but a really good question. And I think it goes back to the discussion about communication and making sure the best interests of the patients are being met. And if there is a problem between the PT and the PTA, this could really spill over into the care being provided to the patient. So to start off, I think if there's an issue, a concern, a conflict, addressing it directly with each other, the PTA talking to the PT about the problem is a good idea. If the bullying behavior or bad behavior continues, you may need to escalate that to the employer to deal with. And ultimately, if it can't be resolved, behavior could be reported to the college. But I think trying to manage it between the PT and PTA first is a good idea. And I think, what do you think?
I think that's right. And I keep going back to the physiotherapist role and the responsibilities inherent within that role. And physiotherapists, it's one of our key competencies to manage the physiotherapy assistant relationship. So that, as Shelley said, the assistant comes to you with a problem. It's your role to identify that tension. It's your role to provide some sort of conflict resolution technique. I think it's all about good communication is underlying all of this, but you should demonstrate a plan to resolve that conflict until prevent it becoming a big issue. If you've worked through all that and you've provided leadership, you've tried to resolve the issue, then, as Shelley said, it's time maybe to move it up to the employer level, and maybe the assistant can even bring it to the attention of the college, but that's a big step. So Shari, again, I'm going to look to you. Is there any other email questions coming in that we should take time to address?
There is a lot. I'm having trouble keeping up, so I'm going to do the best that I can. Please, for those of you out there, please know that I'm going to have to paraphrase many of you to preserve the plea for anonymity. And I am also going to have to bundle some of the questions because there's a couple of questions where a number of different people are asking the same thing in different ways. So you may not see your exact question, but do know that we are going to answer them. The first question I'm going to give to, I think you've answered it already, but I'm going to give you a chance to come at it from a different way. And I'm going to give this one to Fiona. And this one is about managing concerns about performance when someone else does the hiring. So what the person is asking is if their employer hired the physiotherapy assistant and the physiotherapist has concerns about the performance and has addressed it with the manager and doesn't feel like it's being properly addressed, what strategies should they use?
Okay. Again, it comes back. We are a regulated health professional, and with that does come some accountability. you're working, you simply can't assign care to an individual who's not going to do the performance you've required of them with a patient. So you need to directly address it with the assistant. So I would be asking what's you're providing feedback. Let's look at we're managers. You're looking at the task. You're going over the knowledge of the task with that individual. You're perhaps demonstrating what you want with the patient. You're asking them to do it independently. You're providing feedback. You're escalating task development. Again, it's about communication, clear communication. What you expect from the assistant will lead to strong communication and teamwork.
Yeah, and I think, and you alluded to it right at the beginning of your response, that we're managers, and I think what Fiona was referencing is that in the essential competency profile for physiotherapists in Canada, one of the items in the profile is manager, and expecting to manage the relationship and deal with conflicts and supervise all of those things. So perhaps there's ways to deal with it as far as setting goals, as far as achieving learning or behavior, those types of things.
Providing good constructive feedback.
Yeah.
Always respecting the professional role, being respectful, have a respectful attitude with that individual.
Yeah.
Again, have a look at the essential competency role, have a look at the manager role, read through what's expected of us physiotherapists and providing leadership to resolve conflict. It's not easy, and perhaps sometimes it can't be done, but again, it's your responsibility in the management to roll that back to the manager or the organisation once you've attempted yourself to resolve it.
Mm-hmm.
Yeah, it's not an easy situation, is it, where you've got responsibility but no authority. It's a real challenge. So they can always call Shelley.
Yes, you can call me.
And I imagine that the OPA probably would like
That's a
to
good idea.
have the opportunity to assist in these kinds of situations. So good luck.
Yeah.
Shelley.
Yes.
This one we get often, but this person's asking, is there a plan to register or regulate physiotherapy assistants in the future?
Yes, I do get this question. At this point in time, I would say no to that based on what we see here at the college in our environment. So I want to answer your question with some information, but not too much. But I can tell you that the government, there have been professionals, paramedics, dental assistants, physician assistants, and I feel like I'm missing one other group, but they've sought regulation, and there was a decision made not to regulate these groups. So there's a number of factors that weigh in whether or not a group of people become a regulated health professional. And so it's not something that is in our work here at the college right now, but I can tell you the college definitely sees the importance of having really good relationships with the assistants and building bridges and connections with the assistant community, and in the interests of delivering safe, effective patient care. So, I think Fiona was going to mention this in a slide later, but the assistants, for example, can send their email addresses to our communications team to receive our monthly newsletter. So we do want to connect with this group, but at this point in time, the regulation piece is not on the table.
Yeah,
but do you have anything to add?
No, we're
to
definitely
that?
reaching out. We want to build relationships. We want to communicate with the assistants. We know it's important to hear the same message, to communicate, but we don't think there's an appetite right now for regulation. I know our counterparts in the US, you'll understand that their physiotherapy assistants are regulated.
Mm-hmm. So do we?
Okay, the next question is, this one's for Fiona, because I know this one's near and dear to her heart. Why did the college decide to make public whether physiotherapists work with support personnel?
They decided to do that in, I believe, December of last year, and it's becoming public as this year progresses. It's about transparency. We're in a new world of transparency to our patients. So when a physiotherapist chooses a physiotherapist, They want to know who their care provider is. We have that information, so we are going to share it with the patient so they can look, they can see that Fiona Campbell uses an assistant. They can ask me questions about that. So it's really in the essence of giving more information to the patients.
Great. Now, how are we for polling questions?
Move on?
Shall we move on to the next polling question?
Right, so if we go to just to recap, what I'm hearing so far from the questions, it's about the responsibility of the assistants, of the physiotherapists. You've had some questions about supervision, what an assistant can and cannot do, how do you ensure competency? And so this is quite interesting to me. Our next question that I have, I'm interested, if we go to the next polling question.
Oh, wait, sorry, Fiona. I just wanted to say what's on the screen right now is people are looking at our infographic of physiotherapists, support personnel. And so those are our kind of a high-level picture of what is contained in our standard. So sorry to cut you off.
No, no problem, no problem.
I just wanted you to know what you were looking at on that slide.
Yeah, so what you're looking at in the slide there is the 5 key areas the physiotherapist should be looking at when they're working with an assistant. You should be assessing the patient, looking at the environment you're working in, the skill of the assessor, the communication plan that they have in place. But I really want to get at, we know the responsibilities of a physiotherapist when they're working with the assistant is very responsible to ensure good care is given to the patients. Now, you already, as Sherry said, you already indicate whether you're working with support personnel or not, and that's going to be made public. What we're thinking of asking, and we want to know what you think about it, is if a physiotherapist was asked to make a formal declaration to the college that they have read, they know when they have read, they understand the standard expectations for working with an assistant, would more physiotherapists take this seriously? Well, there are a small pocket of physiotherapists we understand who are not applying the expectations, and some of the concerns are coming into us at the college, and those numbers are growing. The majority of physiotherapists are taking on this responsibility, but some either don't understand or are not applying those responsibilities. So would this declaration that you've understood and you're applying to your practice when using physiotherapy assistants, would it make more physios take the expectations seriously? So moving on to the next polling question, your options are yes, it would. Yes, physiotherapists, more physiotherapists would take it seriously, or no, it wouldn't have any impact at all. So can I ask you to go ahead and choose one of those options? We're very interested to hear what your responses are.
What do you think?
I don't know with this one. This is really up to the physios to tell us. We know formal declarations are used with the...
Oh, look at that.
Yeah, with getting on the roster to perform authorised activities. A physiotherapist, to get their name on that list, will make a formal declaration that they are competent and they provide an authorised activity like acupuncture, like suctioning. And we know that these physiotherapists, through the quality assessments, are proving time and time again they understand the rules and they're applying them. Okay. So thank you for your responses. Certainly we're seeing more physios said yes, they think more physiotherapists would take it seriously by making a formal declaration to the college that they understand and apply the standards. Some of you said no, maybe you've got some more ideas. Your thoughts are really important to us, and I'll make sure that your feedback I will take to the council. The council being the board that governs us. That's 19 people, 17 of which are physiotherapists. The rest, 9 are public members who will make decisions on our behalf. So that's the kind of feedback I will take to them before they would choose to implement something like a formal declaration.
Great. So let's. So we have some more time to answer some questions. Sherry.
Yeah. So we've had a couple of questions about PTA students and responsibilities for supervising and evaluating them as students, and what kind of a role that the assistants can play in this circumstance. How much responsibility belongs with the physiotherapist with a PTA student, and how much can you ask the PTA to do? That was kind of confusing. So I'm going to give that one to Shelley. Did you get? I know you can't see me, so did that question come out clearly for you?
I think so. Okay. So you have PTA students, and this poses an interesting thing, because when you think about it, the college has two standards that apply to this situation. We have a standard for physios working with support personnel, and we have a standard related to student learners. So it's kind of holds this interesting position between the two. Now, obviously, the physio has to be involved, and because they're ultimately accountable and responsible for the care they assign to their assistant. But I think there's a huge place for the assistant who would be working with that student. And I think if the physiotherapist and their assistant can spend some time doing a little bit of thought and I guess planning as far as what is within the parameters of the assistant to work on with the PTA student, and what requires direct input from the physiotherapist. I think if you kind of sort that out before you get the student on board, you can kind of figure it out along the way. And you have to take into account the experience of the assistant you're working with. So, are they a new PTA in practice? Have they ever taken a student before? Have they been working with this patient population a long time? So there may be all these factors to consider as far as how much input that PTA has with the PTA student and how much input the PT needs to have. But definitely the PT needs to be involved in this relationship. Do you have anything to add to that, Fiona?
It just, as I hear it, they're retaining responsibility, they're ensuring what physiotherapy assistant's competent with the learner, they're allowing the communication needs to be there. I think you described it well.
Okay, Fiona, the next one is, we've had a couple of people asking this question, and it has to do with weekends, and it has to do with the hospital environment, where you have the weekday physiotherapist assigning care to a PTA, and yet they're not there on the weekend. But there is the weekend physiotherapist who's available on site. Can you talk a little bit about who's responsible in that circumstance and how that should be managed?
And I think that goes back to the communication plan. So if the weekday physiotherapist has assigned the care to the assistant, they can define what can be done at the weekend. Perhaps the weekend physiotherapist can be a contact person, but perhaps some of those questions, the responsibility is kept with the weekday therapist. But there may be other patients, I'm thinking back to my career as a physio, who have too much risk, and you need to transfer the responsibility to the weekend physiotherapist because their conditions are changing, they're acute. You need the expertise of the physiotherapist at the weekend. So rather than just a contact, you're transferring the responsibility to the weekend physiotherapist. So again, it's communication, and it's defining the circumstances of who is retaining responsibility. I'd also like to say, weekend physiotherapists, you can still rely on, if you have a good relationship with the weekday physiotherapists, if they believe the assistant is competent, experienced to deliver care, you as the weekend physiotherapist might be able to have confidence that the assistant, again, has the competency to deliver the care.
Yeah, but just to confirm if I understood though, if a PT is working on the weekend though, that doesn't make them responsible for the patients that the assistant is seeing on the weekend.
No.
That was a decision by the weekday therapist to assign the care to
Yeah.
their assistant. Okay.
So that responsibility is remaining with that physiotherapist,
Yeah.
and there should be a communication that's being done.
Yeah.
However, what I'm saying is there might be some patients where conditions are more acute, or there's
Yeah.
more risk, where you want to just transfer that responsibility
Oh, I
to
see.
the
Okay.
weekend physiotherapist. So I'm saying there's different types of patients,
Yeah.
and it's up to the physio to decide which stream or which
Yeah.
treatment will be given.
Great.
Okay.
Yeah, I think that's perfect. I'm just going to say it again in slightly different words to make sure I've got it. So if the weekday person assigns it, and it can be done completely independently but the PTA can take care of it with no need for an assessment or intervention by the weekend physiotherapist. It's the weekday person who retains responsibility. But in those really acute circumstances where you want a physiotherapist to do an assessment to make sure that it's still okay to assign the care, and the weekend person does it, they're responsible because they do the assessment and then assign it to the PTA.
Okay,
Yeah.
I agree.
Yeah, that's
good.
what you guys are saying?
Mhm.
Perfect. Okay, Shelley.
Okay.
I've got a comment from some PTAs and supervising physiotherapists that many of them are dually trained as OTAs and PTAs.
Yeah.
And so their question is, how similar are the rules for the OT college and the PT college? And did the two colleges work together?
I can tell you that to be honest, I haven't looked at the standard or their practice guideline at the OT college recently, but I can tell you there are lots of similarities. They're worded a little bit differently, but they're very similar expectations. But in addition to that, a few years ago, we worked very closely with the College of Occupational Therapists of Ontario to develop an e-learning module that's on our website and also on the College of OT's website, and it can be used by OTs, PTs, and support personnel. So when we developed this module, it was with the intent that the team could use it, and I have heard back from organizations, they've used it as a lunch and learn opportunity, they've used it as a yearly review for staff on understanding how to work with different team members. So the responsibilities are similar. I mean, if you ever really need to know specifically about what the OTs expect, they do have a practice, they call them practice liaisons, a practice resource person at the OT college as well, like we have a practice advisor, and they also have a guideline on their website about their performance expectations.
I think we still have a little bit of time. So, Fiona, there's been quite a few questions that's talking about what about supervision guidelines with this patient population, or what about supervision guidelines in this practice setting? So, I've heard from a couple of people asking for more information about the home care environment, the long-term care environment, the private clinic environment, with geriatric population and specialized stroke population. So can you talk, just because we can't answer every single question specific to the population in the work practice setting. So can you talk about some of the supervision guidelines and how they might vary or be the same depending on the population and practice setting?
So we don't specify exactly with per patient population exactly what's necessary, but we do believe the physiotherapist is the decision maker, the problem solver. So they're the ones, they'll look at our standard. It's a 2-page standard. There's 5 areas that the physiotherapist is responsible to analyse about the patient, to do an assessment, to look at the results, to look at the acuity, the risk of assigning care to the assistant, to look at the skill of the physiotherapy assistant, to look at the environment they're working. Are they working alone? Is there other team members there? To look at change, to look at how they're communicating. Is it daily? Is it weekly? And based on all of those, and there should be 5 factors. I wish I had the infographic. I think it's really helpful. When you look at all of those areas, you can decide what's the risk, what's the skill of the assistant, and then decide what level of supervision you're going to to provide. So to answer your question, Sherry, it does fall back on the decision making of the physiotherapist.
And there's no rule book or prescription or a recipe. It's
No.
taking advantage of your best professional judgment,
Yeah.
Yeah.
looking at those multiple factors. Shelley, did you have something you wanted to add?
No, I think Fiona covered it well. I think it can be tough, but you just have to look at the principles that are in the standard and think about, okay, how am I going to apply this to the setting I'm in? And the practice environments and the payment models and everything is constantly evolving in health professions. So the intent is to have this standard that helps guide practice regardless of where you go to deliver your services.
Okay, I've got one last question for you, and I'm going to give it to Shelley. It's certainly not the last question, because there's lots more here that we weren't able to get to, so I do apologize for that, and they're going to tell you about how to get your questions answered, even though we don't have time for them. So, Shelley, the last one for you guys as a team is about communicating with the team. So it's the circumstance where the PTA is it's a weekend, and they're on their own, and the team is asking for recommendations for discharge. Can you talk about how to handle that?
Ooh, that's a tough one.
Yeah, it is.
So, that is a tough one. So, I think, oh my gosh.
The PTA,
Sherry.
Yeah, I know. Sorry, that's not fair. I've had a chance to think about it a little bit. So the PTA cannot take ownership for that if they've not had any discussion with the PT. And that comes back to the plan of care stuff I think that Fiona was talking about.
I think so.
Yeah.
And I think setting out for the assistant what they can do with those patients on the weekend. And sometimes people go home and you don't control the timing of when that happens. But I think it really puts the PTA in an awkward position.
Very
and
vulnerable,
I
yeah.
think as well, having some education amongst the team members about individual roles and responsibilities and putting that into context, because you're asking the assistant to be a decision maker when it isn't their role to be the decision maker. Some of that, I think, is an organizational issue, because it may be that another health professional, whether it's a nurse or a doctor or someone putting the PTA on a spot, and perhaps it has something to do with a patient that wasn't even on the weekend list for the assistant. So there could be a number of variables, but I think having a clear understanding of the roles and limits of individual team members is really important.
And we know, we've said it before, the assistant doesn't have the ability to evaluate information, evaluate your need for a discharge.
Yeah.
I wonder if it's as a little bit of misunderstanding of different roles, the nursing assistant versus the physiotherapy assistant. Mm-hmm. One is working independently. The rehab assistant is not. They are an extra pair of arms of the physiotherapist. I wonder if some of our colleagues, our team members, understand there is that subtle difference.
Mm-hmm.
So it's 12:58, and we want to respect everyone's time. So I'm gonna have to cut off the questions. My apologies.
Okay.
Some of you, there are some questions I haven't even opened yet. So just so people know that we're not ignoring them. And I'm going to flip it back to you, Shelley, to start the wrap up.
So to do a quick wrap up, we've alluded to this throughout the whole presentation. There are a number of resources available on the college's website, and the slide it describes how to get to those resources. So click on resources, go down to physiotherapist support personnel, and when you click on that, you'll see a list of the resources that we have. We can go to the next slide, and there's a list there. And there's you have to remember that if you're looking to know what is the rule, go to the standard. Everything else we have in our bucket of tools for you to use are things for you to help understand and apply the standard. So depending on the way you learn or the way you like to hear about things or apply things, some of our resources will have more importance to some people than others. So the infographic, YouTube videos, e-learning modules. So lots of selection, but the standard is the document that sets out the rules.
Go-to.
All right, so... And sorry, I should mention, lots of unanswered questions according to Sherry. They can be sent to me, practiceadvice@collegept.org, and I would be happy to answer those questions for you.
And I would like to just say there is this newsletter, Perspectives. The assistants who are listening in today, send us your name, put your name on an email list to receive that monthly resource. We really want to start talking, building relationships, sharing our information with you. There's no cost, no fee. You're just putting your name on a list to receive an electronic copy of a newsletter.
Great. So thank you for participating today. And there will be an archived webinar available, and I believe it's going to be available sometime later today. And as I mentioned, you can send any unanswered questions to me, the practice advisor, at practiceadvice@collegept.org. And we also have a survey available for you. If you have just a couple minutes, please take time to fill out the survey. It'll help us plan future webinars, meet your needs, and get your feedback on this. So thank you.
Thank you.